Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate, and provide education from our guests' experience.
Today, we're going to be talking about dental education. So to my left, we have Sarah Balian, who is the Program Director for the School of Dental Hygiene and Therapy. And to my right, we have Julia Brewin, who owns an independent dental hygiene practice, as well as being a part-time clinical tutor at the hospital.
I think there is definitely more interest in education, but I think there is still a bit of apprehension to put their foot into the water, as it were.
I think don't see things as mistakes. Really see them as opportunities.
With your host, Josh Hudson.
I think teaching is becoming more popular with many dentists in the early stages of their career and lots of those aspiring to undertake teaching roles. And we're extremely lucky to be joined by two members of the dental education team here at the Eastman Dental Hospital. So first of all, Julia, tell us briefly about yourself. How did you get to this position that you're at now?
Okay, so I actually qualified at the Eastman and never really left. It was one of those funny things that during my training I always said that I would always want to come back as a teacher. It was a thing that I always felt that was a wonderful combination to teach as well as practice dental hygiene. And I thought, hey, why don't I see whether I can do teaching? So I actually stayed on and worked in the periodontal department and then progressed into teaching at the Dental Hygiene and Therapy School.
Okay. And Sarah, what's your backstory?
So I qualified from Barts in the London and in Hygiene and Therapy. And I stayed 5 years in general practice, but actually moving around between general practice and specialist practices, which gave me a wealth of experience. And I was able to use my whole skill set as a clinician. And I hit probably about year 5 and year 6 of doing exclusive clinical work. And so I felt something was missing. And I wasn't probably getting fulfilled in practice as I wanted to be. And an opportunity came up for one-day teaching at King's, and I took it with a big, huge fear of public speaking, with no teaching experience whatsoever, and teaching was not on my radar at all, but felt, opportunities don't come often like that, and I jumped on it and thought I'd push myself out of my comfort zone. From there on, I stayed there for 16 years. And so through time and more days teaching and more opportunities and more experiences that I had, I escalated in the sort of educational ladder, as it were.
And was that shared? Were you working in practice during those 16 years as well then?
Yeah, I was. So the balance completely shifted from doing 1 day teaching and 4 days clinical practice. And then through time, did 2 days teaching, 3 days teaching, 4 days teaching. I held off for as long as I could and moved then away from practice and then went into full-time education.
Okay. And I think most of the team here are part-time practice, is that right?
Yeah, because actually I've obviously when we were just talking about my Eastman stuff, I didn't perhaps share with you that I set up my own practice 14 years ago, which was quite a big thing to do 14 years ago.
Yeah,
if you'd said to me, you're going to do it, and 14 years on, you're going to have a thriving building practice, I'm delighted to say that it was the best thing that I ever did.
And that's quite unusual, would you say?
Well, I'd been working in a private periodontal practice for 17 years and things were changing, and I just thought, hey, why don't I try and do it? And I did it, and 14 years on, I'm still there.
That's great. And still teaching. You
and
haven't
still
given that up
so,
either.
Like I said right at the beginning, it's a wonderful, wonderful combination.
So do you think it's important that there's that mix between being in practice and teaching at the same time?
Well, I think the fact that I can say to somebody that yesterday I was using that exact instrument in exactly the same tooth that you're working on today, and perhaps, that might be a way that you want to use it. That's the way I used it yesterday, but somebody else may say, actually, you might want to use it in a different way. So actually, I think, yes, in answer to your question, I think it is a good combination, and gives the students certainly a bit of a feel for what's going on outside in the real world.
So for people that are listening that might be considering being a clinical tutor or want to know a bit more about what that could involve, what does it look like on a day-to-day basis teaching within a hospital environment?
So clinical tutor, it gives the implication that it is exclusively in the clinical environment, but it really goes far beyond that. On a day-to-day basis, one thing that a clinical supervisor has to accept is that what you may have planned for the day can dramatically change. Mm-hmm. It involves massive problem-solving skills, and those change from day to day. But you are supervising students, you are supporting students, but not only that, is that you're supporting your colleagues around you. The level of responsibility for a clinical supervisor is, quite profound, because when you're treating a patient in practice, or, the student is in the chair, that patient is their world in that moment. And when you're a clinical supervisor, you can have multiple patients, multiple students, nursing team to support as well, so that the students get the best experience. So you've got multiple factors to consider. But it's not just the clinical role. In the background, there are a lot of operational aspects that go into education. There's the quality assurance process of education. There's a lot of policy and procedure to follow, a lot of paperwork to go through. And that's something that's probably not visible unless you're in education.
Yeah.
But I think the role of a clinical supervisor has really changed, because it's not, like I said, about the clinical, it's about the growth of the team and the growth of that student on a personal level. Because a clinical supervisor, if you go in that role, I personally see, is protecting the way of our future. Yeah. It's protecting the profession, and it's protecting the patients, and we hold that quite high regard.
And we're developing our colleagues, let's be honest. I mean, that's the bottom line. We are creating the future of patient care in this country.
Yeah. And ourselves, I think. From my experience, from my limited teaching experience, you have to be on the ball. You have to know your stuff if you're going to try and impart that knowledge to somebody else. So I think it's good for your own development to keep up to date with things if you're going to be in that environment as well. Which
comes back to that whole thing of great combination of work situations. I mean, just sort of following on from what Sarah was saying, I've worked here for many, many years, and I can tell you that every single day is different. And it might, when I say it quickly, it doesn't sound so bad, but when I say it slowly, to say that I've been here coming up 32 years, that is just very shocking. But actually, when I say that 32 years of every single working day that I've come into this place, it's been different. There aren't very many people that probably can say that.
And I think that might instill fear in some, but it offers so much growth for a person, and you develop so many skills from that. Yeah. And initially, when you go through those early phases of your sort of education journey, you come across a problem, you weigh up that problem, you probably go into a slight bit of panic, and eventually you realize you manage things far better, far more efficiently, you grow more confident in your decision-making skills, because sometimes those situations require a decision there and then. And
sometimes those students teach us something.
Oh yeah, absolutely.
Yeah. And sometimes our colleagues teach us some things. So, that's what I mean about it being very different. And I think that's a really very positive thing.
And that's what keeps you coming, I guess.
Well, I think it's the lure, certainly, of people who, I think, like Sarah was saying, there's a bit of a sort of shroud around dental education. I think it's got a very, very mixed view out there in the dental profession, but I think it's a great thing to be able to shape and develop the youth in our profession.
That's the bit I see is the most important, because one of the most rewarding things I find is where the journey starts from someone is that we're investing personally and professionally, not only into our profession, but first and foremost into our students who are human beings. And that is when you see that student go through that journey and go through their ups and downs, because that is life, and see the points of where that moment where the penny drops, or they get it, that light bulb moment. And that's happened to me several times on clinic, where you see the look of relief upon their face and go, it makes sense.
Do you know, I had exactly that situation in Phantom Head yesterday. There we were learning. This is the first time these students have picked up something. They're about to use this sharp metal instrument on a plastic model that is simulating the subgingival environment, and there they are picking it up. And like Sarah says, that light bulb moment is a very special moment, and I'm lucky enough to say that I had several of those yesterday, and that's a really wonderful thing. You can leave thinking you've made a difference. But I'm not suggesting that colleagues out there who are seeing patients of their own don't have light bulb moments with their patients. I think we all do, but I think that seeing that ongoing and on a regular basis is incredibly special.
And it's that variety as well.
Certainly, because everybody's light bulb moments feel and look different and will be at different moments. So, yeah.
Over that period of time, so both of you have been in education for quite a while, should we say? How has it changed? Do you think it's changing as it's going forward? Do you think it's staying the same? How do you think it's changed over that time period?
Having a global oversight of a programme in its infancy and the experience that I've had, it's something that I reflect on quite a lot on changes, because a programme, when in any educational programme, can't stay the same. Is that, yes, we live in the moment, we have to fulfill certain things in educational journeys and certain requirements, but it's also looking and thinking ahead of what more you can offer, what changes might occur in the future. And that's something that probably in recent times I've reflected most on is, where is it changing? Where does it need to change? How can we change it? And the clinical aspect, again, is obviously a massive component to a student's journey, but their personal growth is probably something we invest more in now than we ever did. If I look back on my learning experience, it was very, very heavily focused on clinical pathways, clinical delivery. But when I trained, there wasn't that reflective component. It wasn't about management and leadership, and that's really been brought forward. And that's something that is very challenging to deliver, because it requires personal investment from the student. To ask someone to reflect, to have really open conversations is an individual journey. And that's something that really has changed in recent years.
Yeah, no, I totally agree with what Sarah's just said. I think the thing that I'm getting out of my profession is that it is finally we have reached that magical point where we are respected. It makes me rather sad to think that when I first qualified, patients didn't really know what a hygienist was. So I am talking over 30 years ago. I qualified at a time when people did not necessarily value dental hygiene and dental therapy for that matter. But I am really delighted to say that at this stage, we are now really well respected, part of a group. We are listened to. The fact that we've got the head of our training programme who isn't a dentist, I think is a wonderful thing. And there are many out there throughout the whole country who are running educational schools, who are well respected, colleagues of mine who don't happen to be dentists. And that is a really lovely place to be. I mean, I totally agree with what Sarah was saying about what we're now that sort of individual person that we're training now is turning out to be. But I think we need to go back a little bit further and think, actually, how far have we come from being those people that were perhaps not able to set up a practice, not able to see a patient without our dentist colleagues even having a look at the patient first.
And I think there's two words that I think at the moment, the staff team are really committed to omitting from the students' vocabulary, and that is just and only. Because through training, building on that personal growth, students come in from multiple different pathways, and sometimes when they have their conversations, they don't realise the power of some of the words that they use. And I'm just doing this. I'm just a hygienist. I'm just a therapist. And the conversation stops there, because if we use those words, you've negated your position within the group. So one of the things moving forward is, our remit as an educator is to get a student to a certain point. The point is to get the student to the dental register competently and safely. That's the first and foremost remit. What we see as well is our background remit is giving them that inner confidence to say, once you've got there, reflect on that journey, and there are steps now to follow. You can have diversity in your career. There was a time there were limits to what we could do. There weren't, educational opportunities to further your career. MScs weren't available, masters weren't available, PhDs. And now there's so much opportunity out there. There's multiple masters, and it doesn't have to be in dentistry. You can diversify your skill mix. Yeah. And now those opportunities are there. So one thing we're trying to build into the students is, don't stop here. Have a break. Go through your cycle of clinical practice if that's your journey. But there are opportunities out there, and you have growth.
The staff, when we look at our team, I think it's a great privilege to work in a place like this. And when I say a place, I mean the entire hospital. But actually, let's bring it down to our department and say that, we've got somebody that's been accepted onto a PhD, who's a member of staff. We've got several people who've done masters. We've got some very able people who the students can look up to aspire to. And like Sarah says, as far as I can see, the sky's the limit. You can't do anything. In fact, one of our ex-students has just completed his dental degree at another training school, having done dental hygiene and therapy here already, and then went on to get the best foundation training prize in the year. So, really, we can do anything.
I think a lot of that innovation and development is through the education side of things. People like you and people like
trying.
The team. Yeah.
Yeah. It's not easy. I think trying to change the mindset of the student and trying to get them to think differently about their development, and that also obviously has to start with the staff having different thought processes about things, because nothing stays the same, and we're deluding ourselves if we think that we can stay the same. It's an exciting time, certainly.
Through a very unscientific study, looking at my friends and colleagues that graduated with me, to me at least, it seems like a lot more people are more interested in education now or teaching. First of all, do you think that's the case? Do you think younger people are more interested? And for somebody who is interested about maybe branching out into dental education, how would they go about doing that?
I think there is definitely more interest in education, but I think there is still a bit of apprehension to put their foot into the water, as it were. I think the desire is there, and it's in the back of people's minds, but there is a fear of stepping into the unknown, and also not knowing how to start moving in that pathway. So if there's, bits of advice I would give to somebody, in my experience, and through, recruiting team members, when you qualify, or when you've qualified from dental school, there has been a certain protection mechanism around you. The biggest learning curve that I remember, and I've obviously had conversation with colleagues, is when you go solo. And don't forget, it's not mandated for hygienists or therapists to complete vocational training. So they will literally go solo. And it's in those first 2 years of independent practice that you go through a massive learning curve because there's no one there to cushion on. It's always after that point, I would suggest starting to make your move, because those first 2 years of making those independent clinical decisions and management decisions of where you're working offer you opportunities and experience. From there on, if a post arises, is put your foot into the water and go for it. It's very difficult to put an advert out for an educator's role when the pool of educators actually isn't that wide. So usually job descriptions have asking for 2 years post-qualification experience. If you have teaching qualifications, obviously that's an absolutely massive bonus to the individual.
That was the next thing I was going to ask about. There seems to be a huge amount of people undertaking education postgraduate certificates. Is that essential? Is that something that's needed, do you think, if you want to go into dental education?
Most of the tutors who I've recruited through my years of experience in different organisations, the majority have not had teaching experience. Mm-hmm. They go through a cycle of mentoring. So usually we say within the first year is that they will go through, clinical supervision, dabble in academic delivery, and obviously with support. But then that person needs to think about where they want their career to go, where they want to do their qualification. Yep. Is it a clinical education certificate? Is it an academic one? And so it gives you the range of what the job offers, and that you won't see necessarily from a job description.
Yeah.
It's also very difficult to get a teaching qualification unless you've had some teaching opportunities. Yeah. So let's be honest. So that's also something to consider. So is to throw their hat into the ring whoever wishes to obviously jump that next step.
Do you agree with that, Julia?
I would be tempted to say to last a little bit longer in the outside world before coming into teaching. I think 2 years in my personal experience, I think is not quite long enough. I would tend to go for that sort of 3 to 5 year period. But I totally concur with Sarah. I think people should not be intimidated by coming into a department with no experience, with no formal teaching qualification. I think come in, be embraced, be mentored, find out what is your preferred sort of situation within the teaching environment. I think that there are so many things that we have to get involved in, as Sarah's touched on, process, content, quality assurance, all sorts of different things will make a colossal difference to the education of our students. And so I think come with an open mind is probably my biggest bit of advice.
Yeah, because I think there is a bit of your phrase, the shroud earlier was a good one, because you will, on the face of it, you will only see what is on clinic and in a classroom, won't see necessarily what goes on directly in the background unless you go through that experience.
Yeah.
But we have one of the other things that I would strongly suggest people do is reaching out to their own previous tutors or tutors of other schools. All those sort of email addresses and contacts are usually available on schools' websites, and reach out and have a conversation, because everybody's experience and journey is very different. So at least in that way, the person who's asking can get some bespoke advice, which is...
You can even just, make an appointment and try and come in and see the department, come in and talk to people. We can even... Now, we have this virtual world. One can even just have a conversation with somebody, in an indirect way, but you're still seeing them. So I think one of the things that I hear a lot of people say who come into teaching, and it was definitely the case for me, is that they observed good teachers, or perhaps not so good teachers, and thought that they felt as though they might be able to do things slightly differently. So I think, reflect on what happened during your training and think, hey, did I enjoy it? Did I not enjoy it? Did I feel as though I could do something a bit different? I think it's great.
And show willing. So a little bit of experience and then...
Well, I think it's that open-mindedness. I think, we've got to be open-minded when we see our patients, because you just never know who's going to be walking through the door. And we never really know what our working day is going to be like when it comes to teaching and our patients here in the hospital.
And I think one phrase is be brave.
Be brave.
Be brave. And I mean brave in a positive way, because... I mean, as I said before, I just remember my French oral exam for GCSE was probably the last time I'd done really any public speaking. And I still have anxiety about it. But then I knew that was one of my biggest fears. And then I went into the job, and the first thing I did was this presentation. And now it's fine if it's, one person, or if the room's filled with 500 people, I'm fine doing it. So it's actually accepting that there are massive growth opportunities. Our job, when we go into a job, we want to do our jobs well, but we sometimes neglect ourselves. And actually, this job and our profession, our clinical jobs, offer us absolutely massive personal growth that is transferable elsewhere. And so I just think it's, be brave, be open-minded, and the path is very much open to many opportunities.
And I think don't see things as mistakes. Really see them as opportunities, as learning experiences. I think if you got a bunch of dentists and a bunch of hygienists and therapists and all sorts, and dental nurses and the whole team around the table, they would all say that whilst they've had some crushingly bad experiences, either in their training or seeing patients, all of them would say that those events have shaped them and have developed them as either individuals, like Sarah says, or as clinicians. And I think we need to embrace those moments and not be terrified and frightened of them.
I think that's really good advice. On a more practical slant, where are these jobs advertised? So Sarah, you advertise for people to join the team, and elsewhere people advertise to join their teams. Where would people start if they wanted to look for these applications?
So my experiences is most dental education providers can go through two routes. One is it can go on NHS jobs, and two, they can go via university websites. The other, I hate to say it, but social media is a fabulous place because most organisations, whether it's NHS jobs or the university directly with the university, schools will post in these forums to say a post has become available to widen that net. So those would be my top three. Mm-hmm. The other one is actually to contact the school that you are most interested or is most feasible for you to join. Yeah. I would say one thing, though, is that because of the way we're working now and a lot of education has moved online, is don't think that distance will limit you for sure. Is that, we have some members of staff, and I know colleagues of mine in other organisations, the post that they're in is based, in central London, but they actually live in Wales and what have you. Yeah. So there is now a lot more flexibility. So there's time where we're on site and there's time when we're teaching online, and online could be done from across the world. So, there is an opportunity there. So I wouldn't necessarily limit it to your geographic location. Touch base with a school or multiple schools. They're very good at usually saying predict when jobs might come out, or keep you on reserve to let you know when jobs do come out.
Yeah, I think keeping in contact with your preferred educational provider that you have a vision for going to. And like Sarah says, now in the virtual world, you don't have to be either in the same country or the same borough in London. So I think the bit that I would say is make contact directly. I mean, clearly there are opportunities of getting jobs in the usual forums, NHS jobs and what have you. But I think just sending some contact out to that school to say, hi, I'm thinking about it. Can anybody chat to me? I think is a really good place to start.
Don't forget, the opportunity is for us as well. Because if we've had contact with an individual, and obviously applications are anonymous, but it also gives us an indicator of what the appetite is and what questions are asking. So that will also drive a bit of a change for us in the background. So, contact really works both ways. We very much, and we have done, and will continue to do so, but touch base with people who've got an interest.
Perfect, thank you. And we're asking all of our guests the same final questions. So first of all, if you could both describe the 3 things that you enjoy most about your job.
Who's going first?
Well, we could always take it in turns, can't we?
We can take it in turns. The bit I most enjoy about my job is watching the growth of the staff and the student, first and foremost.
Julia?
Okay, so mine's very similar. My big one is having those light bulb moments with people that you are in a room with who just magically get that moment of working out how to put an instrument to a tooth, or anything else for that matter.
Most enjoy about my job is creating opportunities, because of the sort of the impression that actually we have to achieve only one certain goal, but if I see that there is a project, a contact, a network, an opportunity for a person to diversify or demonstrate their skill set, or be accoladed in some way, whether that's a staff member or a student, I will take that opportunity, and I love trying to find those opportunities for everybody. Although I probably don't take them all myself, unfortunately, and I offer them out to everyone.
And I think just working with the most amazing team of people. I think we are extremely lucky in this dental hospital. I have seen it go through colossal change, with a change of leadership, with a change of site, with different consultants coming and going, different staff coming and going, different students. And I can honestly tell you that every single colleague has shaped me in my professional career.
I totally agree. I think another thing for people considering it, in practice, it can be a lonely place. And I think certainly for me, when I spend my time in the education department here, going from clinic, where it might just be me and the nurse, it's great to have that interaction with other colleagues. So I totally agree with you, Julia, about the team aspect.
I think my final one, and I could give you a list of them actually, but I'm going to put this one here, because actually I was working with a colleague on a presentation the other day, and they highlighted it to me, and I thought, reflecting on all of that, I thought, God, they're absolutely right, was the creativity opportunity. We have to be creative, and sometimes we forget. We were talking about this earlier, is that we go into our normal phase of doing things and ticking boxes, but there is a massive opportunity for creativity. And the creativity, because you have to think about how you're going to deliver a piece of information. So rather than just putting it on a PowerPoint or do as I do or do as I say, is that we have an opportunity to be creative, but that's actually something more personal. And someone said to me, and they were absolutely right, is that it's actually really therapeutic. And that's what I enjoy, is it's work, and I have to create a presentation and think about how I'm going to deliver it. But I find it actually, don't find developing content stressful. I love the creativity that goes behind it. And they were absolutely right. It is therapeutic. And it's actually really restful. Surprisingly.
So I think the creative bit, I think it's an interesting bit, because that really means that everything's very different. And when I think about my final third thing, that is what I love about my job the most, is the differences. The differences between my students, the differences between my patients, the difference between my colleagues, the difference to my mindset. I might have a different mindset that day. I may be more open to things. I may be more closed to things. I may just have a very different view on my profession. I may have read something. I may have listened to a podcast. I may have been inspired. I may have been crushed. I may have had all sorts of different things. But that's the key word, it's different. So actually, nothing ever stays the same.
And finally, having got to the point that you're both at now, if you were to go back in time, what one piece of advice would you give to your younger selves?
If I could go talk to myself again, I would turn around and say, recognize your achievements. I think on the journey that we do, because we are responsible for the supporting staff members and supporting students, and that is, if you take it personally, which we all do, is that it's an immense responsibility to hold, people's career paths, whether they're staff or students, in your hands. And being on that journey of my own development is that I probably didn't recognize what I had achieved when I had achieved them. And we're not given that, not given, but we probably don't take the time out personally to say, wow, I've learned a lot. I've done a lot. I've achieved a lot. There's lots to learn from it. I've made mistakes, but you know what? You're very right, Julia. Mistakes are okay.
Yeah.
And as long as we reflect on those, and we build on them and move forward, that's the path. But I would say to myself, enjoy your wins and the self-recognition, and really look at what you have learnt through the whole process.
Yeah, I think we're all guilty of that. It's reaching a goal and then instantly
moving on
to
the
next one.
Yeah, exactly.
What about you, Julia?
Well, I've touched on it a little bit earlier when I said that I think the mistakes are not really mistakes. They're life experiences, and I think you just need a little bit of time in between these events, as Sarah's just described. Give yourself a little bit of credit there. But I suppose it's also about regret, isn't it? Do we regret the things that we do or the things that we don't do? And I think that some of the things that I've done in my life, I think, wow, I can sit back and think I would have regretted not doing that. So I'm going to say, don't regret, in whichever way you want to take it.
Perfect. Thank you both so much for joining us. We really appreciate it.
Thank you.
Having worked with you both, it's been really interesting to hear about your own journeys, and I'm sure the listeners have found it very useful too. Thank you
very much.
Thank you.
Thank you.
We hope you have enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe and listen out for future episodes.